Commissioners. Good evening, good afternoon, staff, community members, EDC. Thank you for coming over to this meeting. This meeting is the Juan City Commission is calling an emergency meeting in accordance with the Texas Open Meetings Act, Section 551.045, regarding the threat to the public health, coronavirus, the COVID-19. Mayor, as last night, Mayor and I were talking about during the afternoon, and he asked to be called an emergency call meeting for this kind of it may not be yet a catastrophic event, but it's one of those that it's an emergency meeting for this type of things. The coronavirus is not one to be taken lightly. It's one of those that needs to be taken seriously. So earlier this morning, staff and I, we got together. We got some conference calls with the Texas Health Department and also Hidalgo County. So we put some stuff together for review for your presentation. And there's a matter of fact, the Chief Garza, you can come to the podium. He put something together for us so that he can explain what to look for, what are the precautionary measures, what is the state of Texas actually working on, the Hidalgo County, what are some of the measures that we're looking to take into consideration for this kind of outbreak. It was an epidemic sometime a couple of weeks ago. Now it's a pandemic. It's a virus that is spreading pretty fast across the world, not only here in the United States. So we're taking proactive measures so that we can eliminate it, but always contain it to the minimum. And so having said that, Chief.
Thank you, Mr. Arnold. Good afternoon, Commissioners, Mayor. Real quick, as we all know, we've been all hearing in the news, and as far as the coronavirus, steps we're taking into mitigating some of the spread is going to be close. What was discussed earlier this morning with Mr. Arjona and some of the staff. Pretty much, we all know how it spreads, and just at about 2 o'clock this afternoon, the president knocked it down and the CDC from 50 gatherings to 10. Of course, the socializing distance 6 feet, and that'll pretty much alleviate some of the spreading. Supposedly, what they're making their recommendations. We're taking steps, of course, and of course, in putting it out there as mitigation process and to eliminate some of the spreading of the coronavirus. Mainly, it spreads mainly through person to person. People are close contact with one another within 6 feet. It's the respiratory, the droplets produced when an infected person coughs or sneezes. The bacteria droplets can land on the mouth or nose of people nearby or inhaled by people nearby. Other ways transmitting the disease is by touching the surface that has the virus on, or then touching your mouth, nose, or eyes. Of course, we've got a lot of events that have been canceled also throughout the state, and local jurisdictions also are canceling a lot of the events. I think it just got notification they just canceled the livestock show too.
Oh, they did?
Yes, they just ceased all operations over there. And they were trying to decide earlier today when we had the conference call with the county, so they finally pulled the trigger on that. So it's pretty.
So, and we also got word that the school district, PSJ ISD, went ahead and extended another week for spring break. If I'm
correct.
Yes, is that correct? Oh.
Yes, sir.
Okay.
The next slide, please. Of course, the signs and symptoms is basically like the influenza. Illness have ranged from mild symptoms to severe illness and possible death. Symptoms can include fever, cough, shortness of breath. It can take anywhere from 2 to 14 days for the symptoms to appear. We're putting out flyers also at all the city buildings in reference to putting them in English and Spanish also to eliminate, to prevent it, so people can pretty much see that we're actually putting it out there as far as the mitigation part of the virus itself. Prevention, avoid being near persons that are infected. Of course, we've advised some of our employees or some of our staff that if they feel ill, for them to stay home. And avoid touching your mouth, nose, and eyes. Stay home when sick. Avoid going out into the public and spreading the virus. Cover your mouth and nose with a tissue when sneezing rather than your bare hand. Center of Disease Control does not recommend people who are not infected to be wearing the face mask to protect themselves. Next prevention, of course, face masks should be worn by the people who are infected, health workers, and people who are caring for someone in closed settings such as at home or health care facilities. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating and or blowing your nose, coughing, or sneezing. Questions so far? When infected, okay, restrict your activities outside your home. Expect for getting medical care. Separate yourself from the people and animals. Call ahead before visiting your doctor. This will help the healthcare facility to take preventive measures to prevent the spread of the disease during your visit. People who are infected should wear face masks when around other people. Avoid sharing personal items. Clean all high-touch surfaces every day, such as counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, bedside tables, and keyboards. And discussing that with Mr. Arjona, I think we're going to look into setting up some additional personnel to clean up, disinfect the areas, and I think the area of main concern is going to be
our cleaning staff that goes around the buildings.
correct.
I think they're going to have to go, more frequent,
Frequently, and also they need to cover themselves as far as gloves and
Yeah.
stuff when they pick
And,
up
and,
on
and do we have all that, as far as?
Currently, as far as getting items, we tried to place an order last week and everything was pretty much in back order. But the medical gloves and everything like that, we can provide, the fire department can provide some to these people that are doing the actual cleaning till we do get some in stock. Yes, sir. Most definitely. I think we're going to set up something once we discuss the time frame. I think it should be every hour. As soon as they vacate the location, they need to sanitize all the facility. So that's part of our plan, our action plan that we want to put into place, of course, and at City Hall also. The main people of concern is going to be, of course, the residents and, of course, our staff. We're going to try to mitigate the best we can, and we're following under the guidelines from the CDC and also from the county. The conclusion from today's meeting, conference call that we had, they were still trying to finalize some numbers and to decide to either to elevate to level 2, and but we should be getting notification on that agreement or the discussion today from an email. Or did you get any, Mr. Arjona, you haven't received any?
Yeah. So for the record, you said you were in a conference call with the county, or was it with the
No, with the
state?
county.
County?
The county call, we just had it a little while ago, and it's regarding to resources. The resources that the state has is very minimal for right now, and they're putting it out to the ones with more confirmed cases, positive cases. So resources, they're looking at suits, gloves, masks, and things like that. So once we find that they're overstocked on it, that those areas have been taken, we'll submit for resources through the state. Also got the notification through the Department of Emergency Management. We can also start doing tracking any expenses that we have or that we incur during this time. We can possibly get reimbursed by once it blows over, and we'll submit for reimbursement.
And this is through where? Like
Through the state.
the state?
Yes, sir. Next slide. That's it? Oh, okay.
That one.
I guess it's pretty much like we discussed earlier. We'll get with staff. I'm going to have another meeting tomorrow with all the directors in reference to tracking all our items that we need to purchase or that we make a purchase to seek reimbursement once, like I said, once it's over. If you have any questions or any suggestions, I'm open for suggestions, and we'll put the action plan into play tomorrow.
Now,
right
as far
after.
as, Chief, as
Yes,
far
sir.
as any numbers, just, reported in the valley, because there's just,
Rumors.
yeah, there's rumors, I've heard that there's one right now, and, then I've heard that there's like 6 out there in the whole Rio Grande Valley. By any chance, do you have a concrete number, or if there's even anything reported?
From the county, no, sir. As far as us here in Hidalgo County in this area, there has been no confirmed cases. Investigations, part of it, the state put out some numbers, but it's throughout the whole state. There's 300 pending tests right now.
And that's required, I guess the question maybe is just waiting on
Yes.
the test, right?
Correct.
Is that correct?
Yes, sir.
So they're expecting it to go up?
Correct.
Once we get, or have the ability to test, correct?
Yes.
Okay.
And there's certain requirements that you need to meet before you can actually get tested. You need to show some symptoms and before they actually do the test. I know that the main lab in Harlingen is where there's some of the tests and there's some other tests available through some private physicians, but the actual numbers that are out there that are under testing right now is 300. We got those. I got those by the state, from the state. Confirmed down here, nothing yet, and I hope it stays that way. But like
Now, for some reason, what if, God forbid, and I hope it doesn't happen, just like what you mentioned, if we do have a case here within the community, is there a place where, this individual or these individuals have to go get quarantined?
I think one of the main items they brought up after that conference call or this conference call with the state, it'll be just a confirmation. You'll get the gender, the age of the person, but no actual name, and they won't exactly where it's confirmed that. They keep that due to the HIPAA law, but the state will advise if in what region it was found, or county, should I say. But nations, we have none, and that's what the Department of Eddie Olivares from the county is stressing. There is no cases, no confirmed cases here in Hidalgo County.
Hidalgo County.
Correct.
I guess this is basically more of a comment in reference to what I'm going to discuss right now. You mentioned that the number was 50, now it's down to 10.
Okay.
Okay, so now with being 10, I was speaking to Mr. Arjona earlier before we started this meeting.
Yes, sir.
He also shared that number was 10. So we're going to have to more likely do some kind of changes if we're even going to hold a commission meeting, because obviously, how many are us up here?
Yeah.
And then we're gonna have,
Correct.
the citizens who come in and sit down in the meetings. So we're gonna do some changes, okay? I know I mentioned to Arjona that more likely the directors will not show up to the meeting, okay? So right? Okay. I just need you guys to be, just in case, phone or whatever, if we have any questions, or just be, you're real good as far as on your reports. They're very thorough, but just make sure that you give Mr. Arjona the proper information that we will be discussing based on the agenda items, okay? But I don't know how we're gonna handle this if we have, let's say, 10 people show up. That's something that we're gonna have to discuss. Or do we just wait and just cancel the meetings? I guess this is gonna be for the commission, and that's what I'm.
Based on what may be on the agendas, correct? If it's to where the body decides and it's only one person deciding, I guess it's an agenda type of thing, right?
They have to, yeah.
Yeah, if it's
If
have to,
then
and then we
have to
look
meet.
at it to see if we gonna need it or not.
Right.
If
And then
not,
play it by ear.
Right.
I think pretty much process for that, we could either live stream it also, and then the directors can be live streaming the meeting. If they need to make contact, we'll go with the conference call or call in or something like that.
No,
to
yeah,
that
yeah,
effect.
but the concern is when the citizens come
Oh,
in and say,
definitely.
we can't keep them out.
Yeah.
Because, obviously the law, right?
Yes.
But, I guess we're just gonna have to kind of, figure this out and see what measures we want to take.
You
Yeah.
go ahead and contact the attorney general's office to see how they recommend we handle the situations. I know that we have an open meeting, and obviously it's open to the public. But I'll get in contact with them to see how we can handle it, to make sure that we're in compliance with the law, the Open Meetings Act and so forth.
Especially right now, Mr. Palacios, in reference to, this is an emergency crisis happening, So you know how sometimes the law, allows us, for instance, how we were able to post this meeting. Just today without even 72 hours. That's what.
And there could be some acceptance to that, so I'll go and check with them to see how.
Yeah, if you can do that.
And we can get on that right away.
Okay.
I think one thing also that we discussed earlier, Mayor, was the quality of water that the city has, being that all these residents are hoarding the water and all that. We're superior water in the water system here in the city, so that's something that might alleviate these people going out there and buying these. Yeah. So we got good quality water from our own faucets. That's something.
We can start blasting out there
Exactly.
and stuff through our social media. Mr. Juana, as far as the water, he's saying to maybe start promoting a little bit more, throwing it out there on our website.
As far as the quality
Quality.
of water?
The quality of water
Yeah.
and being able that there's no reason to panic.
Right,
about the water.
and as a matter of fact, I spoke to Mr. David Salinas about that. Mr. Salinas, can you come over and maybe just say something on the fact that there's not really anything to be worried about as far as the quality of the water, but
Good evening, Mayor Commissioners. This topic actually came up in one of last week's conference calls with the state, because there was a utility up in North Texas that was asking about it. Now, through the state and the water quality standards that we have, one of the things that we looked in removal is viruses. So we already targeted viruses in the system. By law, we have to remove what's called a two-log inactivation of viruses. And to kind of put it into simpler terms, that's inactivation of 99% of all viruses in the system. Both of our water plants are way above that number. In fact, number 2 consistently is at above a 4. And a 4 is like 99.99% log inactivation or removal of viruses. Water plant number 1, because the raw water travels from such a far distance, it actually has a greater than 14 log inactivation of viruses. Can't give you the number on that because there isn't a chart that goes that far. It ends at 7. So it's almost to nothing inactivation of viruses. We treat for that every day on a daily basis. Like the chief said, we are a superior quality standard. We meet those requirements every month. We collect samples, 30 samples every month, so basically a sample a day out in the distribution system. That's on top of the samples that we do at the plant, and we do those basically every hour in the hour. We're always checking something. We report this to the state. In fact, there's a link that we're going to be making available to our public on our website. It's called the Drinking Water Watch link. That's provided by the state. All of the analysis that we do on a daily basis and on a monthly basis go on there. It's not always very up to date, but it's got all the information. I also brought the water quality reports from last year. They're available. We also have it on the website for our citizens to go look at it. And yes, our water is potable. It is drinkable. There's nothing wrong with the water. You can use it to wash your hands. You can use it to bathe in. You can use it to cook. You can drink it. There's nothing wrong with our water. It meets all the quality standards for the EPA and the state of Texas. Thank you.
So that pretty much hopefully will alleviate these, but people get used to drinking a bottled water, so it is what it is. But hopefully we'll put out all this on the city's website. Anything else that you all might have is like I explained to Mr. Arjona.
As far as getting like hard copies of this literature, is there any way we can give them out to when the citizens go pay their water bill?
Sure.
That's it, because a lot of time, there's people out there who do not have access to,
Correct.
internet or anything like that.
Yes, sir.
So I know we get a lot of traffic, our citizens going in and paying the water bill. If we can, have something, this type of literature in English and Spanish,
Sure.
so where we can hand them out to them as well.
Sure
I
will.
think that would be very.
we'll do that. As a matter of fact, we ran, I think, quite a bit of copies for tonight's meeting. But we should have a lot of leftovers that we can put at the office, and we can run some more, most definitely. And also we can provide them with a link that we got this information from, and it's gonna be available at the website. And just again, all of this information that we have here in front of us, it comes directly from the CDC. Okay, so it's.
Go ahead, sir.
We actually, that's a good idea, but we actually can deliver, the literature versus putting it on there and let them open and get them on their own when they leave. hand it over to them, so they can actually take it, you know, so they can have a literature. Because if you give them, if you do it on the counter, you're doing it wrong.
Probably won't take it.
In the situation, you hand it over to them and we try to, target as many people as we can that go into our office. Now, they don't want it, well, as they said, we try to do it.
Sure. No, we can do that as well. Once they pay the water bill, we can return the receipt with the copy of that.
Also, just to let y'all know, as far as fire, police, and all that is, I mean, it's still business as usual. We still need to provide the service, so we're out there 100%. And trying our best. As far as I got an email today from Medcare, they're going to be utilizing their EMD guidelines. If the fire department is not needed and or the police department, they'll eliminate to mitigate some of this spread or contamination.
Go ahead, sir.
Also, I ran a little late, I apologize about that, we're running traffic.
Yes, sir.
But, all right, does the police department and the fire department equipped with any type of mask or anything that?
Yes, sir. Fire, we are. We got all our gear certified for circumstances like that. Yes, sir. Correct. Yes, sir.
And I know you mentioned the amount of people that can be gathered in a location, Chief, whether it be 10 or 50. Now, with the library, Mr. Arjona, how would that work? Being that we have a staff of what, 5, 6, 7?
Tyson?
You know, for as far as allowing people to be in the library, if we're limited to 10
Gatherings.
people.
Oh, for the gatherings,
Because it's from 50, now we're down,
10.
we're to
At 10.
it's, yes, and I agree with you. I mean, if it's 5 staff members, then that'll limit 5 additional patrons to come in. That is a recommended number. It doesn't mean that that's what the
CDC.
CDC, but that's a recommended number by the CDC. We can monitor that if you all allow, you want us to do that. We can, yeah.
Do we have a good amount of kids coming in, or? Slow? Okay. Right. Yeah.
Recommendation.
Recommendation, yeah.
Be proactive on that stuff that you're saying, and we can monitor it. I mean, if they have to come in for educational reasons, where stuff like that, school's gonna start, classes may be online or what have you now, so we maybe have to up that number a little bit.
Yeah.
So if there are recommendations, because I know it mentions restaurants are included as far as the gathering amount, so nobody's gonna monitor that.
The business is pretty much on their own. Once, it depends what the county comes out and declares or what their preparation recommendations are gonna be.
Yeah, because the county judge recommended 50, and I know you're saying.
No, they changed that right after we had our meeting.
But the meeting
Yeah.
change it back to 10, or down to 10, yes.
That's one that I saw, the 50.
Even public gatherings.
Yeah.
So,
And
There are some recommendations by the governor and the Attorney General's office already regarding our public meetings. There are some guidelines that they've already set out that would allow for a telephonic or video conference meeting by our governing members. However, there are certain requirements that they're gonna be asking for. They're asking that, one, you must give notice, electronic notice, and also like a toll-free number that they can dial in, and they can, if they wish to give a public comment, they can call it in. And so you have to have a toll line, toll line and also, an electronic copy, somewhere where they can get it on electronic and get a copy of the agenda. And then lastly, the only thing that needs to be provided is we would have to provide a copy of the recording of the telephonic video conference meeting, so we'd have to provide that. I'm not certain, if we're uploading those online yet or not, but if we choose to go that route, those are some of the requirements that they have. So, yeah,
We're also waiting to see what the template, or no, not the template, whatever wording the county utilizes, and if you all decide that you all want to go into that state of emergency, we'll have that prepared, ready for you.
Any other questions for Chief Garza? If not, we'll go ahead and adjourn. Is there a motion to adjourn?
Just before, Mayor, again, this information is available on the website, and it'll be available at the city facilities as well, starting tomorrow, right? But the information is available at the web. Where's Mr. Pat? But there was gonna be immediately after the meeting. As far as we know, it's what we have here in front of us, which is the English version of it, but we'll try to get the Spanish one as well.
Yeah, if you can do that.
Yeah.
Okay.
Yes. Oh, it's both? Okay, so it is in both, Mayor.
So is there a motion to adjourn? Is there a second? All those in favor say aye.
Aye.
This meeting has been adjourned at 5:26 PM. Thank you.